specifically Sierra Leone and Liberia.
Right.
And we're going to be taking a deep dive into their history and how it intertwines with devastating disease outbreaks like Ebola.
Okay.
So you've provided us with a really interesting mix of sources here. Historical accounts, personal stories, and medical research.
Yeah.
And it seems like you want to understand not just the virus itself,
Right.
but the impact of history, poverty, and social structures on these health crises.
Yeah. That's a crucial lens to have because epidemics never happen in a vacuum.
Right.
To really grasp the devastation of Ebola, we need to look at the region's history.
Yeah.
From the transatlantic slave trade to colonialism
Right.
to the recent civil wars.
Yeah, and the book Fevers, Feuds, and Diamonds really brings that to life.
Yeah.
It just paints this chilling picture of Ebola's impact on the healthcare system.
Right.
Hospitals shutting down, healthcare workers dying.
Yeah.
It just felt like reading about a complete collapse.
What's fascinating there is how the book really shows Ebola exploiting existing weaknesses in already fragile health systems.
Yeah.
It's almost like war had devastated the healthcare infrastructure, and then Ebola came along and delivered the knockout blow.
Right.
It's this horrible cycle of one crisis compounding another.
Yeah, and it wasn't just a lack of hospitals or equipment.
Right.
The book uses this term, clinical desert, to describe the lack of healthcare professionals in these regions.
Yeah.
How do you think that this clinical desert contributed to the high mortality rates from Ebola in West Africa?
So the book draws this powerful contrast between Ebola's impact in West Africa versus developed countries.
Okay.
Americans and Europeans infected with the same strain often survived,
Right.
while many West Africans did not.
Yeah.
And this disparity wasn't just about the virus itself.
Right.
Access to quality healthcare was a major factor.
Okay.
The clinical desert you mentioned played a significant role in those high mortality rates.
So it's almost like there were two different diseases. Ebola in a resource-rich setting
Yeah.
versus Ebola in a region ravaged by poverty and conflict.
Exactly.
Same virus.
Yeah.
Drastically different outcomes.
It forces us to ask how much of the death toll was due to the virus itself,
Right.
and how much was caused by these compounding factors like lack of resources and fragile healthcare systems.
Yeah.
It's a complex question with no easy answer,
Right.
but one that needs to be asked.
And it's impossible to talk about the human cost of Ebola without talking about Dr. Humar Khan,
Right.
Sierra Leone's Ebola czar.
Yeah.
Here's a doctor already fighting Lassa fever,
Right.
working in these incredibly difficult circumstances,
Yeah.
who then steps up to lead the fight against Ebola,
Right.
only to die from the disease himself.
Dr. Khan's story really embodies the courage and dedication of healthcare workers in the face of such danger.
Yeah.
And it's not just about clinical skills.
Right.
The book highlights his research collaborations with American colleagues on Lassa fever. This points to the potential for international collaboration.
Yeah.
But it also underlines the immense loss of expertise when someone like him is taken from us.
It makes you think, what if there had been 10 more Dr. Khans?
Right.
Could the course of the Ebola outbreak have been different?
If we connect this back to the bigger picture,
Yeah.
his death really emphasizes the need for sustained investment in healthcare systems and training in these regions.
Yeah.
Losing someone with his expertise is a devastating blow,
Right.
especially in a clinical desert.
And another theme that keeps emerging from these sources
Yeah.
is the issue of trust.
Yeah.
Or rather, the lack of it.
Right.
Resistance to safe burial practices, suspicion towards foreign aid workers.
Yeah.
Deep-seated mistrust seems to have played a role in the epidemic's spread.
What's interesting here is the book argues that this mistrust stems from historical injustices,
Right.
centuries of exploitation, from the slave trade to colonialism to modern-day resource extraction,
Yeah.
have fueled this suspicion towards outsiders.
It was chilling to read about how in these Ebola-stricken areas, people came up with their own explanations for the outbreak,
Right.
blaming witchcraft, sorcery, or even the government.
Uh-huh.
It seems like when trust in institutions erodes,
Right.
people turn to alternative explanations,
Yeah.
even if they lack any scientific basis.
It raises an important question.
Sure.
How do we implement public health interventions when faced with such deep-seated mistrust?
Yeah.
We can't just parachute in with a Western-centric approach and expect blind trust.
Right.
Building relationships,
Yeah.
listening to community concerns, and addressing the root causes of mistrust are critical.
So it's not just about fighting the flames of the epidemic,
Right.
but understanding the fuel that feeds it.
Precisely.
And that fuel is often the legacy of historical injustices and exploitation.
Mm-hmm.
To truly address these health crises, we must confront these historical wounds.
Yeah.
Which brings us to the larger question. How does the history of Sierra Leone and Liberia shape their vulnerability to outbreaks like Ebola?
The book makes a really powerful argument for understanding epidemics through a historical lens.
Okay.
Centuries of exploitation left these nations with weak infrastructure, limited resources, and deep societal divisions.
Right.
All these factors make them particularly susceptible to outbreaks.
It's like all these factors, the exploitation, the weak healthcare system, the highly contagious virus, the social issues,
Right.
all converge to create this perfect storm.
And what's even more striking is that we're seeing similar patterns emerge with the COVID-19 pandemic.
Right.
This talk you mentioned is COVID-19 becoming a black disease.
Yeah.
Makes us think about how social inequalities, even in developed nations, shape who is most affected by outbreaks.
It's a sobering reminder that epidemics often expose and amplify existing societal fault lines.
Right.
Access to healthcare, economic opportunity, trust in authorities.
Yeah.
Those who are already marginalized often bear the brunt of disease outbreaks.
The book details how even after the initial Ebola outbreak was contained, new transmission chains kept emerging, linking urban and rural communities across West Africa.
Okay.
And this really demonstrates the immense difficulty of eradicating a disease when social and economic inequalities persist.
It highlights the need for sustained long-term commitment to strengthening health systems.
Yes.
You can't just swoop in with an emergency response and then leave.
Right.
We need to invest in building resilient healthcare systems that can withstand future shocks.
The Ebola outbreak, and indeed any epidemic, is not just a medical problem,
Yeah.
but a social and political problem as well.
Okay.
And to effectively address these challenges, we need to move beyond simply focusing on pathogens and treatments.
So we need to broaden our understanding of these events.
Oh,
We
yeah.
need to look beyond the immediate medical crisis.
Precisely.
We need to understand the historical context, the social factors, the political landscape.
Yeah,
Only then can we start to develop effective and sustainable solutions.
absolutely.
Fevers, Feuds, and Diamonds delves deep into the history of Sierra Leone and Liberia, starting with the transatlantic slave trade. Right, and it paints this grim picture of how the slave trade not only decimated populations,
Yeah.
but also introduced new diseases and weakened traditional social structures.
The slave trade was a horrific chapter in human history,
Yeah,
and its impacts continue to reverberate today.
right.
It's not just the physical and emotional trauma inflicted upon millions,
Yeah.
but the long-term consequences for social and economic development.
Yeah.
It's a wound that never fully heals.
And it seems like this wound made these countries even more vulnerable to exploitation by colonial powers.
Right.
European powers carving up Africa, imposing their own systems of governance, extracting resources,
Yeah.
often with complete disregard for the health and well-being of the local population.
Colonialism further exacerbated the inequalities created by the slave trade.
Okay.
Traditional economies were disrupted, artificial borders imposed,
Right.
and systems of governance often benefited the colonizers at the expense of the colonized.
Yeah.
It's like building a house on a foundation of sand,
Yeah.
inherently unstable.
Yeah. And it seems like healthcare was not a priority for many colonial powers.
Yeah,
The book describes how even basic public health measures were often neglected,
right.
leading to preventable outbreaks of diseases like malaria, yellow fever, and sleeping sickness.
There seemed to be this pervasive attitude among colonial officials
Right.
that the health of the native population wasn't their responsibility.
Yeah.
It was viewed as a local problem,
Right.
which led to inadequate funding and resources for healthcare.
Yeah.
It's a tragic example of how colonialism perpetuated health disparities.
It's striking how the book mentions medical deserts again. But this time, in the context of colonialism,
Right.
healthcare access was often limited to European colonists
Yeah.
and a select few Africans working for the colonial administration.
Right.
The vast majority of the population was left to fend for themselves.
Access to healthcare has always been intertwined with power dynamics and social hierarchies.
Right.
It's crucial to acknowledge these historical injustices. If we aim to create more equitable health systems,
Right.
dismantling the structures that perpetuate these inequalities is essential.
It's like a race where some runners are given a head start,
Yeah.
while others are forced to carry heavy weights.
Right.
It's not a fair competition,
Uh-huh.
and the outcomes are predictable.
That's a great analogy.
Yeah.
And it underscores the importance of advocating for policies that promote health equity
Right.
and address the social determinants of health.
Sure.
These historical injustices continue to have a ripple effect,
Yeah.
and we must actively work to counter them.
Even after independence, many of these countries continued to grapple with weak healthcare systems and recurring disease outbreaks.
Right.
The shadow of colonialism seems to linger.
The transition to independence was often turbulent,
Right.
and many newly independent nations faced challenges in building functioning healthcare systems.
Yeah.
Shortages of trained personnel,
Right.
limited infrastructure,
Yeah.
lack of political will to prioritize healthcare. All contributed to this struggle.
Right.
It's a complex issue with no single explanation.
Corruption also seems to have played a role.
Yes.
The book talks about funds meant for healthcare being siphoned off by corrupt officials,
Right.
leaving hospitals and clinics understaffed, undersupplied.
Corruption's impact on healthcare systems is devastating.
Yeah.
It erodes trust in public institutions, discourages investment,
Right.
and ultimately leads to poor health outcomes.
Yeah.
This is a global challenge that demands attention.
And then on top of all of this, you have the added burden of civil wars,
Oh.
brutal conflicts that further ravaged healthcare systems, displaced populations, and created breeding grounds for disease outbreaks.
Civil wars are incredibly destructive to a nation's health.
Right.
They disrupt healthcare services, displace populations,
Yeah.
create food shortages, often lead to psychological trauma.
Yeah.
It's a tragic cycle.
Right.
War weakens health systems.
Yeah.
And weak health systems make it harder to recover from war.
It's like trying to rebuild a city after an earthquake while the ground is still shaking.
Right.
A truly daunting task.
Recovering from conflict requires a long-term commitment to peace building,
Okay.
reconciliation development.
Right.
Addressing both the physical and mental health needs of the population is crucial.
Right.
We need to recognize that the scars of war can linger for generations.
Speaking of lasting consequences,
Yeah.
the book delves into the impacts of specific diseases like malaria and sleeping sickness.
Right.
These diseases, often neglected by colonial powers, continued to plague the region, hindering economic development and causing widespread suffering.
Malaria and sleeping sickness are prime examples of neglected tropical diseases that disproportionately affect poor and marginalized communities.
Right.
And despite their significant impact on health and well-being,
Yeah.
they often receive inadequate attention and funding. This underscores that health disparities are not just domestic issues,
Right.
but global ones.
And it's not just the physical suffering. The book also discusses the social stigma associated with these diseases, how people could be ostracized, and how fear and mistrust hinder efforts to control outbreaks.
Stigma is a powerful force with devastating consequences.
Right.
It's important to challenge these harmful beliefs
Yeah.
and foster a more compassionate and understanding environment for those affected by these diseases.
So we're seeing this recurring pattern.
Yeah.
A history of exploitation, weakened healthcare systems, neglected diseases, civil wars, all converging to create this perfect storm of vulnerability.
Right.
And then Ebola emerges onto this scene.
Ebola, a highly contagious and deadly virus, thrives in environments with weak healthcare systems and limited resources.
Right.
It's a tragic illustration of how social and economic inequalities make certain populations more susceptible to disease.
Like a predator that targets the weakest members of a herd.
Exactly.
Yeah.
This pattern applies to other infectious diseases as well.
Yeah.
The book draws a parallel with the 1918 influenza pandemic,
Right.
which swept through West Africa,
Yeah.
claiming millions of lives already weakened by malnutrition, poverty, and the legacy of colonial exploitation.
The 1918 pandemic serves as this chilling reminder of how infectious diseases exploit existing social and economic inequalities.
Yeah.
It really emphasizes our interconnectedness. The health of one population can profoundly impact the health of others.
It's a domino effect.
Right.
One event triggers a cascade of consequences that ripple across borders and generations.
Right.
This really underscores the need for a global perspective on health.
Right.
And a collective effort to create a more just and equitable world.
So we've covered a lot of ground.
Yeah.
The impact of colonialism,
Mm-hmm.
the devastation of civil wars,
Right.
the burden of neglected diseases, and now we've arrived at the Ebola outbreak.
Okay.
It feels like we've been meticulously laying the foundation for understanding how this tragedy unfolded.
You've captured it perfectly. To really grasp the scale and impact of the Ebola outbreak,
Right.
we must understand this historical context.
Yeah.
It's not just about a virus.
Okay.
It's about the intricate interplay of social, economic, and political factors
Right.
that created the conditions for this outbreak to occur.
So let's dive into the Ebola outbreak itself.
Yep.
The book describes how it began in this small village in Guinea
Right.
and rapidly spread across borders,
Yeah.
overwhelming healthcare systems, causing widespread panic and fear.
The initial response to the outbreak was delayed and insufficient.
Right.
Lack of resources,
Yeah.
poor coordination,
Okay.
and a general misunderstanding of the disease
Right.
all contributed to the initial struggle.
Yeah.
The harsh lesson on the importance of preparedness
Right.
and investment in resilient healthcare systems.
The book paints this vivid picture of the chaos and fear that gripped the region.
Yeah.
Hospitals were overwhelmed. Healthcare workers were dying at alarming rates. Communities were torn apart by suspicion and mistrust.
It was truly a horrific time,
Yeah.
and it speaks volumes about the resilience of the human spirit,
Yeah.
that people could come together and ultimately contain the outbreak.
The book also highlights the heroic efforts of healthcare workers who risked their lives to care for the sick, working tirelessly, often without adequate protection, to provide comfort and support.
Healthcare workers are the true heroes on the front lines of any epidemic.
Yeah.
Their dedication and bravery deserve our utmost respect and gratitude.
And it wasn't just doctors and nurses.
Right.
The book also mentions community health workers, burial teams,
Yeah.
countless volunteers who stepped up to help in any way they could.
It's a powerful reminder that in times of crisis, ordinary people can make an extraordinary difference.
Yeah.
They are the backbone of any response effort.
The book describes some of the immense challenges these responders faced: shortages of supplies, cultural barriers,
Yeah.
and the constant fear of infection.
Those challenges were overwhelming.
Right.
And the fact that responders could overcome them
Yeah.
and eventually control the outbreak
Yeah.
speaks to their dedication and resourcefulness.
The book also acknowledges the role of international aid organizations like Doctors Without Borders and Partners in Health in bolstering the response.
International aid organizations provided crucial support,
Right.
offering medical care, training healthcare workers,
Yeah.
raising awareness.
Okay.
Their contributions were invaluable.
But it wasn't always a smooth process.
Right.
The book describes tensions between international responders and local communities,
Yeah.
stemming from cultural differences, language barriers, and a history of mistrust.
Those tensions highlight the critical importance
Yeah.
of cultural sensitivity
Right.
and community engagement in any response effort.
Yeah.
Collaborative work with local communities,
Right.
listening to their concerns, respecting their customs and beliefs
Okay.
are essential for building trust.
It's like building a bridge across a chasm.
Ex-
It requires understanding and cooperation from both sides.
And that bridge is built on a foundation of trust, respect,
Yeah.
and a shared commitment to overcoming the challenge.
Yeah. So we spent the first part of our deep dive really exploring that historical context
Right.
that shapes the vulnerability of Sierra Leone and Liberia to these health crises.
Yeah.
The slave trade, colonialism, civil wars, neglected diseases,
Right.
all these factors created a perfect storm,
Right.
setting the stage for the devastating impact of the Ebola outbreak.
Now we're going to shift our focus to some of the human stories
Yeah.
that are woven through these sources.
Right.
Because behind the statistics
Yeah.
and historical analysis,
Yeah.
there are real people whose lives were profoundly affected by these events.
And the personal narratives you shared are so powerful.
Yeah.
One that really resonated with me is the story of Yabam, this woman from Sierra Leone whose life was tragically intertwined with both the Civil War
Right.
and the Ebola outbreak.
Yabom's story is like a microcosm of the larger challenges facing the region.
Right.
She experienced the brutality of the conflict firsthand,
Yeah.
losing loved ones, being displaced from her home, witnessing unimaginable horrors.
The book does a remarkable job of conveying the war's impact on ordinary people,
Yeah.
describing the widespread violence, the fear and uncertainty,
Right.
the disruption of everyday life.
It's through stories like Yabom's that we can really grasp the human cost of conflict
Yeah.
beyond just statistics and headlines.
One passage that really struck me was when Yabam said, "The war met me in the village."
Oh, wow.
It's such a simple phrase,
Yeah.
but it captures that sudden and brutal intrusion of violence into her life.
Right.
One day, everything's normal, and
Yeah.
the next day, her world is shattered.
It emphasizes that sense of normalcy being completely upended.
Right.
Security and stability just ripped away.
And it wasn't just the physical violence that was traumatic.
Right.
The book talks about the psychological scars left by the war. The lingering fear, the mistrust, the sense of loss and displacement.
Absolutely.
Yeah.
These wounds can take years, even generations to heal.
And just when it seems like Yabam's life couldn't possibly get any worse,
Right.
she's caught in the crosshairs of the Ebola outbreak.
It's almost unfathomable what she endured, losing several family members to Ebola,
Right.
including her mother, and then being infected with the virus herself, and quarantined in a treatment unit.
It's layers upon layers of suffering.
Her story really brings to light how interconnected these challenges are. How conflict can weaken health systems. Leaving countries like Sierra Leone and Liberia incredibly vulnerable to outbreaks like Ebola.
There's this truly heartbreaking passage in the book where Yabam describes being released from the Ebola treatment unit, having survived the virus, only to learn that her mother had died while she was quarantined.
Wow.
It's like escaping one nightmare, only to walk straight into another.
It really emphasizes the devastating ripple effects of these events. Even survival doesn't mean an end to suffering.
And even after surviving both the war and Ebola, Yabam still faces hardship. The book details her struggles with the long-term consequences of the virus. The physical weakness, the psychological trauma, the social stigma.
Her story is undoubtedly a testament to the incredible resilience of the human spirit. But it also serves as a stark reminder of the profound and lasting impact these events have on individuals and entire communities.
It's a powerful reminder that epidemics don't just appear out of thin air. They're shaped by history, by poverty, by conflict, by social structures that make some populations more vulnerable than others.
To truly understand the Ebola outbreak, we need to understand Yabam's story. We need to understand the stories of all those who were impacted by this tragedy.
You also included the story of Ibrahim, a young man from Sierra Leone who also survived Ebola. And his experience provides kind of a different perspective, focusing on the challenges faced by survivors.
Ibrahim's story is particularly compelling because it really delves into this issue of stigma and the long-term consequences of Ebola. The book describes how even after recovering from the virus, he faced discrimination and social isolation.
It's hard to believe that even after surviving such a harrowing ordeal, he had to face this kind of treatment from his own community. The book mentions how people were afraid of him, avoiding contact, whispering behind his back. He was treated like an outcast.
It's a tragic reality that stigma can be just as debilitating as the disease itself. It can prevent individuals from seeking treatment, hinder their recovery, and isolate them from their communities. It really speaks to the fear and misinformation that often surround these outbreaks.
And it wasn't just the social stigma. Ibrahim's story also highlights the long-term health consequences of Ebola. The book describes his ongoing struggles with physical weakness, joint pain, and vision problems, long after recovering from the acute phase of the illness.
Those long-term effects are often overlooked in discussions about outbreaks. But they can have a significant impact on survivors' lives. The need for ongoing medical care, rehabilitation services, and psychological support is critical.
Despite these challenges, Ibrahim's story also reveals the incredible resilience and determination of Ebola survivors. The book talks about how he became involved in efforts to support other survivors and raise awareness about the disease.
He channeled his experience into something positive, educating others, advocating for better health care. It's a powerful example of finding strength and purpose, even in the face of immense adversity.
Both Yabam and Ibrahim's stories really reinforce the importance of this biosocial approach to understanding and addressing health challenges. We need to look beyond just the biological aspects of disease and consider the social, economic, and political factors that contribute to vulnerability and impact recovery.
It's about seeing the whole picture, treating the patient, not just the symptoms.
Right.
We need to understand these social determinants of health.
Yeah.
Things like poverty, access to education, clean water, adequate health care that play such a crucial role in shaping health outcomes.
You've also included some fascinating historical accounts in this deep dive. And one figure that caught my attention was Paul Cuff.
Right.
Can you tell us a bit about him?
Yeah.
Why his story is relevant here?
So Paul Cuff was a remarkable figure in the early 1800s. He was a successful ship captain, merchant, and abolitionist who advocated for the resettlement of free African Americans in Sierra Leone.
It seems like he was challenging the prevailing racist attitudes of his time. And advocating for the rights of African Americans in a way that was truly ahead of his era.
He firmly believed in the power of education and economic empowerment. He saw Sierra Leone as a place where free Black people could establish a new society, free from the oppression of slavery and discrimination.
His story brings up this larger debate about the role of resettlement in addressing the legacy of slavery and colonialism. It's a complex issue with no easy answers.
There were many different perspectives at the time. Some, like Cuff, believed resettlement offered opportunities for African Americans and could foster stronger economic and cultural ties between Africa and the Americas. Others viewed it more skeptically, seeing it as a form of removal that didn't address the root causes of racism and inequality in the United States.
It's interesting to consider those different viewpoints and how they reflect the complexities of history. But regardless of one's stance on resettlement, Cuff's story really highlights the agency and determination of those who sought to create a better future for themselves and their communities. Even in the face of immense obstacles.
It's a reminder that even in the darkest of times, there are always those who strive for justice and equality, who fight for a better world.
So we've explored some truly powerful personal narratives. Like Yabom and Ibrahim's stories. And we've touched upon the legacy of historical figures like Paul Cuff. What other key takeaways emerge from these personal and historical accounts for you?
One of the most prominent takeaways for me is the critical importance of trust. The book repeatedly emphasizes how mistrust, often rooted in historical injustices, can undermine public health efforts and exacerbate the impact of epidemics.
We see this so clearly in both Yabom and Ibrahim's stories. Yabom faced rumors and conspiracy theories about Ebola, which led to resistance against safe burial practices. And Ibrahim experienced social stigma even after recovering from the virus. This mistrust isn't coming from nowhere. It's a direct result of centuries of exploitation and broken promises. If we want to effectively address these health challenges, we need to acknowledge this historical context and work to rebuild trust with community.
It's like trying to plant a seed in barren soil. You need to cultivate the ground first. Create a foundation of trust and understanding before anything can truly flourish.
That's a perfect analogy.
And that process of cultivating trust requires listening to communities, respecting their traditions, and genuinely addressing their concerns.
Another key takeaway that really resonates with me is this interconnectedness of health challenges. We've seen how conflict, poverty, weak healthcare systems, neglected diseases, all contribute to this environment of vulnerability. It's not just one factor, but this complex web of interconnected challenges.
It's like trying to solve a puzzle. You need to see all the pieces and how they fit together before you can find the solution.
And finally, I think these personal and historical accounts really bring home the immense human cost of these tragedies. It's easy to get lost in the numbers, the graphs, and the scientific jargon. But we must never forget that behind all of that are real people whose lives have been irrevocably changed.
The stories of Yabom, Ibrahim, and countless others are a powerful reminder that these are not just abstract concepts. They are stories of human suffering, resilience, and hope.
And those stories have the power to move us, to inspire us, and to guide us as we work towards a healthier and more equitable world.
That's a great point. To transition to the final part of our deep dive, we've explored the historical context and the profound human impact of these health crises. Now in part 3, we'll connect these narratives to some of the broader themes of global health. and explore the valuable lessons we can learn from these experiences.
I'm looking forward to delving into those broader implications.
Brief.
View in Part 3. So we've journeyed through the history of Sierra Leone and Liberia, explored the personal narratives of those impacted by conflict and disease, and really started to unpack the social and economic factors that make these regions so vulnerable.
Right. We've seen how historical injustices, from the slave trade to colonialism, created this foundation of inequality that continues to shape health outcomes today.
Right.
And how those inequalities were further compounded by conflict, poverty, and neglected diseases, setting the stage for outbreaks like Ebola to wreak havoc.
Right. Now, in this final part, I'd love to zoom out and consider the bigger picture.
Okay.
What can we learn from these experiences? And how can those lessons be applied to global health challenges today?
One of the key ideas that emerges from these sources is the importance of what's called a biosocial approach to health.
Okay.
It's not just about treating the disease itself.
Right.
It's about understanding the social, economic, and political forces that make people vulnerable in the first place.
It seems like a more holistic approach, acknowledging that our health isn't just determined by biology.
Right.
It's also shaped by our environment, our social circumstances, the systems we live in.
Exactly. It's about recognizing that health is a product of this complex interaction between our bodies and the world around us.
Okay.
So while developing new drugs and vaccines is crucial, we also need to address issues like poverty, inequality, and lack of access to education and clean water.
It's like tackling the root of the problem, not just the symptoms.
Right. If you have a plant that's wilting, you need to give it water and sunlight.
Right.
Not just trim the leaves.
That's a great analogy.
Yeah.
It's about creating conditions where people can truly thrive.
Right.
Not just survive.
Yeah. And the book gives this striking example.
Yeah.
Even when effective treatments for diseases like malaria and cholera were available in Sierra Leone and Liberia, people were still dying because they couldn't afford the care or they just didn't trust the healthcare system.
That really highlights that access to healthcare isn't just about availability. It's also about affordability, accessibility, and as we talked about earlier, trust. It's about addressing those social determinants of health that create barriers to care.
Think of it like building a house.
Okay.
You need a solid foundation before you can add the fancy decorations. And in this case, that foundation is built on social justice, equity, and human rights.
So how do we apply this biosocial approach
to global health challenges today?
Right. What are some concrete steps we can take to address these complex, interconnected issues?
Investing in health system strengthening is a crucial starting point.
Okay.
It's not just about reacting to emergencies,
Right.
but proactively building resilient systems that can provide quality care to everyone.
It's about taking that long-term perspective, building those levees to prevent floods rather than scrambling for sandbags when the water's already rising.
Exactly.
Yeah.
And those systems need to be tailored to the specific needs and context of each country and community.
Right.
There's no one-size-fits-all solution.
Yeah.
We need to be flexible and adaptable,
Okay.
considering the unique cultural and social factors at play.
The sources also emphasize the importance of community engagement and cultural sensitivity.
Absolutely.
We can't just come in with our prepackaged solutions and expect them to work in every setting.
That's right, imposing solutions from the outside. Without understanding the local context is often ineffective and can even be harmful.
Yeah.
We need to work collaboratively with communities, listen to their concerns, understand their perspectives, and respect their traditions.
Right.
It's about empowering communities to take ownership of their own health.
And the book gives some great examples of how this was done during the Ebola outbreak.
Right.
Working with traditional healers to promote safe burial practices, using local languages in educational materials involving community leaders in decision-making processes.
Those are all excellent examples of how to bridge the gap between Western medicine and local knowledge and practices.
Right. It's not about one being superior to the other.
Right.
It's about finding that common ground and working together towards a shared goal.
Exactly.
It strikes me that this deep dive has been about so much more than just Ebola. It's really a story about the legacy of historical injustices, the power of human resilience, and this urgent need to address the root causes of health disparities.
You've hit the nail on the head.
Yeah.
We've seen how poverty, inequality, and social injustice create vulnerability to disease and hinder efforts to improve health outcomes. These are complex systemic issues that require comprehensive solutions.
So as we wrap up this deep dive into the intertwined fates of Sierra Leone, Liberia, and disease outbreaks like Ebola, what are some key takeaways you hope our listener will carry with them?
I think the most important message is that health is not just a scientific or technical issue. It's a human issue, a social issue, and a political issue. It's about the choices we make as individuals, the values we uphold as societies, and the kind of world we want to create.
I love that. It reminds us that we all have a role to play in creating a healthier and more equitable world.
Absolutely.
It's not just the responsibility of healthcare professionals or policymakers. It's a collective responsibility.
Absolutely. And as you continue to explore the world of global health, keep asking those why questions. Why are certain populations more vulnerable than others? Why do some interventions succeed while others fail? And most importantly, what can we do differently to ensure that everyone, everywhere, has the opportunity to live a healthy and fulfilling life?
Those why questions are crucial. They challenge us to think critically, to look beyond the surface, to understand that complex interplay of factors that influence health.
And by asking those questions, by seeking deeper understanding, we can start to envision and create a more just and equitable future for all.
Thank you for guiding us through this incredibly insightful deep dive.
Oh, you're welcome.
It's been a journey filled with both heartbreak and hope, reminding us of the challenges we face, but also the power of human resilience and the potential for positive change.
It's been my pleasure. And to our listener, I encourage you to continue exploring these issues. Read more, learn more, and engage in conversations that challenge your perspectives. There's always more to discover, more to understand, and more we can do to create a healthier world.
And on that note, we'll wrap up our deep dive.
Okay.
Thank you for joining us.
Thank you.
Until next time, keep exploring, keep questioning, and keep diving deep.